and A I have made. 4 S's means you can see what are those SSS. Okay, the nerves that start with S and the one that start with A. And nerves of medial cord also 4 M's and U. From that you can write down what are all the branches. Similarly, if you use the word stars for the posterior cord branches, you can write up. And what are the terminal branches that we will be asking you frequently, then you should be able to tell, keeping this mnemonic in mind, my arm up. So that will give you a cue, what are all the branches. Hope you are taking a note of these things and you will do it as an exercise. That's why I am not reading out what are all those branches underneath that. That will be your memory exercise for you. Then these diagrams also, relations of the first part, second part, third part of axillary artery, because the brachial plexus divisions, branches, cards, all are related to this one. So that's why you should practice this diagram in whichever book you are reading. This is a must for you. Then if you have the orientation of this axillary artery brachial plexus formation and the relation between the two, then you will score full marks and your learning will be enhanced. So interrelated topics you should read together. Then you can see the flexor retinaculum. There's another question commonly asked, and how to remember it also, and how to draw a simple diagram also. If you see these two diagrams which I have kept, they are easy for you. And the upper one is, it doesn't require more artistic talent. Even a simpler one also, one can draw. What I have understood, I have drawn it like that instead of going into the deeper details. But you can get the mnemonics and how they have to be arranged from lateral to medial, from structures superficial, and what are the muscles attached. Those things you can see. And there is a mnemonic also which you can note down: median duo, radial trio. That means in the midline and radial side, and ulnar side also trio, and 2 tendons each, quaternary in ulnar bursa. So in this one, this is the one they are mentioning, and this will help you. So this helps you to how to draw the diagram, recollection from dissection, orientation, and mnemonics. All are there. And if you practice something similar like this, it will be good for you and you can understand and reproduce. Similarly, diagram is more important than the table next, I said. So importance of diagram, and more than that, you see, I have put the directions, that is important. And what is above, what is below laterally, what is above and what is below medially in relation with the arterial anastomosis around elbow joint. So whenever any arterial anastomosis, you can give the branches from one artery, the branches from the other, and the same thing with the knee joint also. Around that, you can write the same, use the same one principle as I have used in this diagram. This is the one. Hope you got the message of importance of this diagram. Then see this one. So you can practice the diagrams in handy and keep them ready for your examination. For example, sections of the midbrain will be asked as a question at superior colliculus and inferior colliculus level. Similarly, for the medulla also, at the sensory decussation and motor decussation. These are important diagrams. So draw and label the diagram. That is most commonly asked. If it is now in the present scenario, they may ask it for 3 marks, or they may ask correlate with blood supply. Then you have to see it. Think about the syndromes, clinical aspect also, because that's knowledge, you have to use it for clinical application of these sections. Whenever there is an injury at this level, what are all the tracts that will be affected and what blood supply will be affected? If the blood supply is affected, what parts will be affected and what functions will be affected? Like that, you have to link these ones. So that will help you. Then see, I'm not a good artist, and immediately if I have to draw within 5 minutes one flashcard, this is how I have made it. This is for the soft palate. And within that, in the diagram, we have shown the everything, and then I have noted the point. Levator valley palate, tensor valley palate, their actions I have shown with arrows. This will help you remember better how many upper arrows I have put, how many lower down I have put. These are the things. And palatine aponeurosis, how it is formed, that can form an MCQ. For that also, you keep the points here itself. Then see about the motor innervation and sensory innervation and how it is by. So any deviation Those things will all come, and add a note on development also. First arch derivative, what one, like that you can plan it all in one flashcard. So the representative diagram is there, and this one, it may look crowded, but when you are reproducing in the exam, so you can make it in an order also. Then if there is a question on that, see, there is a question of a 40-year-old person coming to medical OPD, complaint of difficulty in swallowing, speech, and nasal regurgitation of fluids. And when he was asked to open the mouth widely, so deviation of the uvula to left side, asymmetry of pharyngeal arch, with sagging of soft palate to left side. So give anatomical explanation. Why they are giving this much length? What anatomy? Uvula, when they are talking, means you should think of soft palate. Then what is the anatomical basis? For which you have to give the explanation. So what nerve is affected? Right vagus nerve is affected. What are the muscles supplied by it? So through what branch? And when that is paralysis is there. So what will happen to the isthmus? So what will be there when it will be closed during speech and swallowing to reduce the muscle tone, because of the muscle tone is reduced. And all the muscles of soft palate except tensor palatai are supplied by pharyngeal branch of vagus. Yesterday I was telling you the exceptions also you should remember. And what happens to tensor palatai is supplied by the medial pterygoid, which is a branch of mandibular division of nerve, mandibular nerve, and first arch derivative. So like that, unopposed action of this will cause the soft palate deviate the uvula to normal side. This much explanation is required, means how calculated you should be. You should do an exercise and then you will do it. Just like driving a two-wheeler or whatever you want to drive also, precision is important. Here also the type of precision you should think of it. And based on that, if it is given as an MCQ, so because with the knowledge you are having background and with the diagrams, what all you have practiced, you can come to the conclusion it is the right vagus nerve that is involved. That is the MCQ also you can prepare simultaneously. Similarly, another example, pharynx structure for understanding. What is the simplest black and white, the diagram which I could make is this one to understand the orientation. And there will be a clinical question on what is Killian's dehiscence. Further, you should have a knowledge of these pharyngeal constrictors and what is pharyngobasilar fascia. These are all MCQs. And this is the first one is the, which I have given a tick mark, is the simplest one. Then you can refine over it. And then you can interpret what is Killian's dehiscence and what is Juncus diverticulum. So if you read, you will understand it. So keep this in mind and then do this as an exercise. Then see, draw and label and link, understand linking also. You can do it, and how you can link it with that is thalamus, internal capsule, cerebral hemisphere. What is the link between you? All these things. And you know this diagram, all of you are well versed with this diagram of internal capsule and what are the boundaries for it and what are the parts and what are the fibers that will be traversing. And see again, what you miss is you forget to put these directions. That's why it will be confusing. And if you put the direction, you will be in the right path. Then, so see the blood supply, the parts of it you are saying in this one and how they will be going, highlight those things. So what is anterior, posterior, sublentiform, and then how the, what is the genu and what are the fibers, how do they travel, and have an idea. Somebody has not muted that one.
Please mute your mic.
Then the blood
Everyone, it's a request to mute your mic once you enter the classroom.
See, so that is the blood supply of it also. You should be thorough. If you are thorough with the internal capsule diagram and then the parts of it and the fibers that are traversing and but the blood supply, then the thalamic nuclei also. You should practice a simple diagrams only. These you can practice and practice these diagrams and orient with them. And what is lateral, medial, anterior, posterior? See the directions that were put in this diagram. So that will make you understand that one. And this is the one. So about the pathways at the various nuclei, and you can see what are the efferent fibers, and there are known what are known as thalamic radiations. What are those 4 radiations and which nucleus, fibers through which nucleus pass through which radiation? All these will be explained within this diagram. And if you correlate it with the cerebral cortex. So cerebral cortex, the various functional areas, particularly on the superolateral surface, is a commonly asked question. Sulci, gyre, and functional areas. So that way you have to see, and in that another one you have seen is the blood supply also of this area you are seeing. And blood supply of thalamus is all there. So blood supply of internal capsule is important. Why is if there is an obstruction to the artery, then what functional areas will be affected? If it is in relation with internal capsule, what fiber bundles which are closely packed within the internal capsule will be known, and to which functional area or from which motor area they are coming. So that also will give you a clue what type of paralysis. You can link it as a clinical correlation of it. And so this is how the functional areas, where is the frontal eye field, prefrontal area, motor speech area of Broca, Wernicke speech area you will see in the parietal lobe, and visual and auditory area, somesthetic association areas. So you can link with this one with you. If you have got this background on your mind, then see this one, practical oriented also. You are seeing a cut section of it. And then in this, what is shown? So what is the pharynx? What are the different components of pharynx? Link it with this one, X-ray. And what about the pharynx? This part, oral part. Then there is the laryngopharynx, how you will link it. So, and what are the various folds in relation with the larynx also? You can practice in radiological film also. If it is an MRI film, it is available, and that also you can learn from that. CT pictures. So these type of exercises, it is also will help you to retain the different methods for identification and retention. Then what you are seeing is the already a diagram of the first rib and how to link it with the bone, and take the bone and identify these parts and try to match these. So where it is going, this part, where is it? You should be able to mark it here. So by looking at this also, you can mark, and what is the scalene tubercle and what is in front, what is behind also you can do. And then comes the making a table. Otherwise, first step and its relations. First, you should draw the diagram, understand it, and then write the table. Then the quadrangular and triangular spaces, if you see. So first you can practice a diagram like this, what you have seen here. And then from that, you can draw what is the quadrangular space, what are the upper triangular, lower triangle, you are able to identify. And with your fingers, if you start practicing like this, then you can answer. And in the exam also, nobody will mind if you keep your fingers like that and go on working on that. So no invigilator will not say. You can practice it fully, okay, not openly showing to everyone, okay. So you can have this in mind, and then you will be able to write it without tension. And you have to give the boundaries and contents you should plan by reading it the course in the dissection or the otherwise also. So this is about the quadrangular and triangular spaces. And by looking at it, this is another one, suboccipital triangle. Everyone say it is very difficult and we cannot understand. But you have the orientation. You can do it. This I have taken from somewhere. And this was good. We can ask you to practice. And you are seeing one person has written the question, boundaries and contents of suboccipital triangle when we have asked. The handwriting may not be that good, but the presentation is good. And if you see, look at the diagram, good at diagram, that candidate, and we could match it with what they have written. So this is another one. Don't worry about your handwriting, and wherever it is not good, and for the important names and all, use capital letters, all capitals, and don't go on writing sentences. She has written sentences, but somewhat better we can read it. Then another question you are seeing, superficial and deep cardiac plexuses. Many people think that this is not required. This is required. Okay, this has got importance. And this is the simplest diagram I could draw. And with the table, you will understand what is the plexus. Okay, that is one thing. Similarly, for the coronary sinus also, plan a diagram and then what are the veins, what is the location and termination, what are the tributaries I am mentioning in the table. So that will help you understand better and reproduce also in the examination is better. Same thing you have to plan for right coronary artery separately, left coronary artery separately. So if they ask the circulation, coronary arteries, you can combine both and write. Then here you can see all in one page, ready to read. Okay, no question of flipping the pages. So put them in all in one page if it is there. Then you can do it. And this is the Pudendal canal and contents. And imagining where the Pudendal canal itself is a bigger exercise for you. And look at the pelvis, articulated pelvis or separate hip bone also you take, and then find out what is the from pubic symphysis, ischial tuberosity, how it will be going and what are its contents, because it has got a lot of clinical importance. And you can make a table like that for its pudendal nerve. If it is a question, you can write with the same diagram, pudendal canal, same diagram you can follow. And pudendal nerve itself, when they ask, you can plan this one. Similarly, the perineal membrane also, that question also, you think that I don't know what to write. If you practice this diagram and this table, you will be able to do good and have a orientation either through by looking at the images, dissection images, or going through any YouTube, or orient first with the articulated pelvis. And what is in the anatomical position, you have to keep it that pelvis is another one, which is superficial to deep. They will be thinking in an anatomical position, you have to go on orienting these things. And that you will learn during the perineum dissection. Then see another one, rotator cuff muscles. So that is a commonly asked question. If you have the diagram like this and with the relations, then you can write what are rotator cuff. And I have already given the tip for it. Hope you can recollect. Yes, it's is the tip for this muscles. And with that mnemonic, you can identify. And in relation with the upper end of humerus, where there will be CT is on greater tubercle and other ES is on the lesser tubercle. Okay, so this is the one. And similarly, the scrotum. Okay, the layers you can see, and blood supply, veins and nerve supply, because it also has a clinical importance. You should practice, and this is a simple diagram to practice. Then I was yesterday mentioning, I did not find time to show you this one, and the development of face, that I have left you with beautiful face yesterday night, and you will be all thinking, what is that beautiful face? What will happen to that face? And in the development of face, you know what are the three processes, and which are paired and which are unpaired also, you know, and how to mark them, what area is developing from that process. By if you mark like this, then you will know what are the processes that are developing, and the how frontonasal process, globular process, and you can see what is lateral nasal process. And in this diagram, you see what was drawn to this, and with a table. And what is the developmental component? What is its relation to stomatodeum, each process, and what parts of face it is forming? And with this type of animated, whether you call it as animation, it's the simplest form which I can represent, I have represented. And you can also try, you are all very good at these advanced techniques. You can plan it and you will enjoy it, and you won't feel that the studies are a burden. You will enjoy and you will simplify it better than me. That's what I expect from each one of you. And this is the one. Hope you have your doubt about that beautiful woman, why I have used that beautiful face is face is an index of mind. So that will give you some stimulus to your brain also, I thought, and I have incorporated. Hope you have understood the importance of it. And numerology, that's the same thing I have used. So I will skip on this one. Then another one, I have prepared one, flashcards also. You can keep flashcards, easiest way. So even when you are traveling also, you can go through it. So don't think of taking the mobile and I can read from mobile. Don't do that. Practice this one and a quick diagram of styloid apparatus. There's also another question, and in that also you can see what to focus. What to focus? Something disturbance is coming. What to focus on that is attachments. What is the nerve supply? What is the development? What are the actions of these muscles? Relations, applied anatomy. Under these categories. So what is styloid process? What are the three muscles? What are the two ligaments? Like this, if you have a map, then and there, where from they are developing also I have shown. And what is the nerve supply? And where it gets attachment, tongue, hyoid bone, thyroid cartilage. And another thing, ligaments. What is, I have put a star mark because one of it is coming from pharyngeal arch, other is the modified deep fascia. Because why I have put it, this will be asked as an MCQ because they want to test whether we have read in depth or not. Okay. So multitasking hub. Okay. So that is the one. This is a multitasking hub. That is about this styloid apparatus. I have noted what points I have noted. And another thing is macroscopic structure of kidney. Okay, within the substance, how it will be. These are the kidneys you study. And if they make a cut section of it, what is inside it. So this will be useful for you. No, don't think it is only for anatomy. It's useful for understanding your physiology also. And once you make a good cut section is there. So you can read what is cortex and medulla and correlate it with your histology. So where is the glomerulus, where is the nephron part, and where is the proximal, where is the distal convoluted tubule, collecting tubule. So what parts in cortex, what parts in medulla. If you add a diagram of the nephron, you can get the details of it also. So this is how it will be. Then see, both sections are there. In that you can see. Same one opened like a book page. Now you can understand what are major calyx, minor calyx, and how they are entering into the ureter. So this helps you in understanding the gross anatomy. And similarly for the mammary gland also, they will be asking about the lymphatic drainage and what is the difference in the lymphatic drainage for the parenchyma, that is skin of nipple, and areola, and what about stroma? Like this, if you prepare the skin except nipple and areola, superficial lymphatics. So what about that? One, if you prepare a table with a flow chart, how they will be traversing these lymphatic plexuses, you can understand it and read the theory and prepare a flow charts like this with your understanding and recheck and keep it there with a diagram showing all the details. And this is about the axilla, and this one also you have to show. So why they will be, what is Krukenberg's tumor, they will be asking as a question. So for this you should understand this part and then this diagram, then you can represent it. Then the lymphatic drainage of upper limb, if they ask also, you can have a diagram like this with the axilla shape and what are the lymph vessels. Okay, so how they will be moving and what are lymph nodes and how they will be categorized and what are the different axillary nodes you can mention. This is another simplified diagram. Then now all of you start drawing this image. Okay, follow it and draw. I will give you 2 minutes time. Okay, once this is over, all of you should be able to draw and give an expression whether you are able to do it or not. Are you ready? Start drawing and labeling. Easy diagram. Even if you cannot draw that blue one and pink one, okay, follow that yellow one and green one. Because ultimately I'm going to show those only. Okay, how you can draw. Yes. So if you have done this hard way, okay, I will present you with a simpler one. But a mirror image of it. But a mirror image of it. That is, this is on one side and that's on the other side. Agree? Mm. So you could do it. So many hands up, thumbs up means you are doing it. Good. So how much time it took? But Jagadish, you are also there. Good, good. I am having my students who are professors now, HODs. Good, good. Good to see them also. Okay. Yes. So if you find it difficult, take the simplest route. There is no worry. Why do you think that we should show all those things? Okay. So because bio is, they are in front of carotid sheath, which includes all these things. But I did not put the vagus nerve there. It will be another other confusion will come. Okay, that's the reason. You should point out why, madam, you have not put. Okay. Then larynx is another topic. It will be boring for you. Okay. So how to remember so many things. So let us have, yesterday also I was giving an example for the extraocular muscles. What are all the things on which I have to focus? See, cartilages of larynx, how many paired, how many unpaired. Then what are the vertebral levels of cartilages? So upper border of thyroid cartilage, where thyroid cartilage, C4, C5 junction, cricoid cartilage. What are the joints of larynx? So like that you can categorize, and some more ligaments attached to posterior surface of thyroid because they are in numbers 3. Okay. Then muscles attached to posterior surface of thyroid angle. That is, they are also 3 in number. You should remember those 3. And cavity of larynx, 3 folds, 3 spaces in between folds and 3 subdivisions. So then it will be easy for you. You will go on practicing it from above downwards or below upwards. Follow a rule. Okay. Better is come from inlet to down. Okay. That is the above down only is the correct one. And what about the nerve supply also? There are 3. All are branches of vagus. If an MCQ is asked without confusion, if you remember. Okay. Then what about external laryngeal nerve motor, internal laryngeal nerve sensory? What part? Recurrent laryngeal nerve, both. So why both? Okay, motor and sensory. Okay, so that is also motor to what? All the muscles. What is that exception? Yesterday I was mentioning in those exceptions also. So these are the things you should be able to. Somebody was asking previous slide. What is that previous slide? Is this one? Yes. Ligaments and muscles. Then cartilages, vertebral levels, joints. I've just seen it on the, yes. Okay, good, good. Okay, hope you have seen it, Fatima. Yes. Then the cavity of larynx. Okay. Then the nerve supply of larynx. If you keep all these things in your hand and start reading, you will check whether you have covered all these things. Somewhere also are there. But this basic, some help is there for you. Okay. Then regarding the lymphatic drainage of head and neck. Okay, there is a circular chain, inner circular, outer circular. Like that, you can draw circles, okay, to avoid circle marks. Okay, so start practicing. Okay, this is also easy diagram which you can practice. And vertical, you can draw, maybe I have not kept it. So simple. Okay, like that you plan, and what are the, you will understand the lymphatic drainage of structures of head and neck. See, colors and boundaries. Okay, you have to recheck with the table. Okay, that makes your job easy. And if you see here, there is a mistake also will be there. I have put only posterior relations, inferior relations, anterior relations. I have forgotten the superior compartment. Okay, so, and see the colors that were used in this diagram. Okay, if you see this one. So, the mistakes I have marked. And then see here. So here I have put the superior relations and use this was not appropriate colors, but see this is not appropriate. And finally appropriate color. See what color I have to use. What is that? Now you have got the what color I have used for the bursa. Okay, so that is what you have to focus. So some mistakes also, if there are there in the book also, now you should use your logical thinking. What color I should use for the muscle, what color for the artery, what color for the vein, what color for the lymphatics, what color for the nerve, what color for the ligament. Then similarly, if you see extensor compartment, retinaculum of wrist. So what will be missing is, see the direction, lateral and medial if you put. From lateral to medial, what are all the compartments? And how many in number? Each compartment. So that has to be there, and you have to correlate with it. So these are the 9 tendons, a vessel and a nerve pass through these compartments. So lateral to medial, how many? The first one, 2 you have seen. Second one, 3. And third one, 1, single. And fourth one, 4 plus artery. Okay, and there. Then the extra fifth and sixth are single ones. Okay, like that you have to make it. Could you please show something you have asked? I could not see that completely. Then if you see the actions of muscles of mastication, that is another one. So think of drawing something like that on the bone itself. You keep some colored plastinated material and all. We made our students do muscle attachments. I don't have that proper share slides. I don't have. For all the muscles of upper limb and lower limb, we made them practice on the skeleton. So similarly, you can practice on the skeleton. What about the muscles? If you keep something which can stretch, you can pull it, elevation and protraction, retraction, all these you can try with that. And what is why it is important is when you are assessing clinically the trigeminal nerve, why you are asking the person to clench the teeth and widely open the mouth slowly against resistance, putting pressure and allowing it to open the mouth. So what will happen? So if it is normal, what will happen? If it is affected, that is paralysis of which muscle and what will happen to it? These are the things you can practice. So clinically orientation, you yourself can do it on you. Then another one I want to share with you is, so inferior surface of cerebrum, sulci, gyre, functional areas, blood supply. You may get on, usually you may get on the superomedial lateral surface, sometimes medial surface, rarely you may get it, but I am showing it on this one. And how they have done it, see it. So what about the anterior, those who has completed, they will know. Okay, what will be the, on the frontal and this temporal. Okay, then interpeduncular fossa. This is how you can do it with the table. This is one, and you start practicing it. And how they have simplified it. This one. So this is another extension of the diagram. Somebody is talking more. They have to unmute. Unless they stop.
Yes, ma'am, I have done it. Kavya, is this Kavya? Please mute yourself.
Deepa, can you do it?
I
Yes,
have already done it, but it's a humble request that the classroom is going on. Please mute yourself. Please, ma'am, continue.
Okay. So see the pictures. So abbreviation they have used. What is anterior, posterior, lateral, medial, and what type of sulci, gyre they have. I have typed it. Okay. So they, like this also you can practice on your own using the different colors. So like this here, the sulci. Now it has come. Then, sorry. Then the simple one. This is for understanding the blood supply, using the different codes for different arteries. Then how to correlate it? Take a section showing the arterial supply. See whether it is correlating or not. In these two pictures, you can do test, check on yourself. This is anterior, middle, is it going posterior, and what areas and all, then you can understand. Okay. This is one. And this is the brain. With interpeduncular fossa is another question, because most of the people, they said they are having head and neck and neuroanatomy pending. I am showing more for that so that they will have some idea about it. And when that question is asked, this is the interpeduncular fossa. What is its shape? I try to show it. So correlate with that. And what is base of brain, you should know. What is the anterior boundaries and anterolateral, posterolateral, posterior, floor, then the contents, the clinical importance. Like this, you can prepare for it. And this is a diagram that was drawn by me with a nice, because putting some effort it is drawn. And if you ask students also, they are drawing it. So with their understanding, you can draw a rhomboid shape. Purushottam Naidu, correct. Okay. Then this is one. So when you are reading that, whatever related ones also you should read. Interpeduncular fossa you will read. Then correlated with that content, the circle of Willis is also an expected question. You can read about it and how to present it also with a just line diagram. Okay. So what is that? You can expect and shape, location, extent, formation, purpose, all in one, concised in that para. I have tried to concise it. So like that, it will, if you can practice it, it is component specific definition, I call it, so that we can plan and follow the branches with abbreviations you follow, and you should know what are those abbreviations: anterior choroid, posterior communicating, anterior and medial, genicular branches. So this one you should read and have an abbreviation like that, and it will help you. And formation and communications, you can make a table and that will help you. What are the branches also, which you highlight, you will know, and what are the choroidal branches also, and among them, what are the other branches, because it has to be correlated with certain clinical conditions. Then once you have this basic background, you can read about the clinical part of it also, and you can show it on the base of brain also. And these are all the ones you correlate with that, and that is about that part. See, all reading together. Once you started with inferior surface of cerebrum and its sulci gyre functional areas, and what is the blood supply we have seen, and what is interpeduncular fossa we have studied, and what is circle of Willis, content of interpeduncular fossa, and we try to correlate all these things. So for this is an MCQ reckoner is there, and if you look at this one, site of umbilical ring, okay, so what are the four components through that passage, and on the other side you are seeing the adult.
I don't know. He doesn't know, nobody knows, but then nobody knows it's important. એટલે જ અત્યારે વાત થઈ. Nobody knows.
કોણ પણ?
અરે છે મારો એક ફ્રેન્ડ, ફેમિલી ફ્રેન્ડ
Okay.
છે, પણ એ અહીંયા નથી રહેતો અમદાવાદ. ભણવા ગયો છે.
Students, is a
એટલે
humble
ના ના તો
request
પણ
to
કેમ
please
અમદાવાદ રહે?
mute yourself.
Kavya.
બહુ ડાયો છો, ના જેન્યુઅનલી ડાયો છો.
Kavya, you
અને
can
same
discuss
caste
with
નો
me
છે.
later.
Yes,
સેમ
Kavya.
કાસ્ટ, સેમ દાંતનો છે. સેમ.
Kavya?
મળવા લાગી છે. સ્ટ્રેટ્સ હતા.
ઓહ, તો એકદમ આમ
ક્યુટ
set
ક્યુટ
type
છે.
છે.
હા. હે.
Amma, how to mute that
તમારા
Kavya?
બંને.
I am trying,
તો
ma'am.
બહાર જોયો છે એને 2 વાર ફોટોમાં. હા પણ આની આંખો બહુ પ્રીટી છે. તો હું તો બધાને બહુ હાઈપ કરતી. મેં તો જોશીને મોઢા પર કીધું તારી આઈસ બહુ જ મસ્ત છે.
Kavya, please mute yourself.
હા એનું
કાવ્યા.
કાલ મને ફોન નતો કર્યો યાર. ઈ હા હમણાં કઈ પહેલી વાર થી ઉતરો પછી.
Sorry, ma'am, you can
Yeah,
continue
it's
now.
okay. It's okay. There will be, she's busily discussing. We will give her next chance to take the class. Okay, no problem. I will request her to take the class. Okay, so that is the. So this one also. So one side you are seeing what are all the in the embryonic age. The other is in the adult. What you will see in the adult you are seeing. There are also 4 numbers are there. So what are they? What is left umbilical vein? Ligamentum teres, umbilical arteries, medial umbilical ligaments, what is urachus, what is median umbilical ligament. Like this, you have to recollect these things in the examination, and these will form an MCQ. It will help. See another one, okay? The development of peritoneal folds. There is a ventral mesogastrium, dorsal mesogastrium, and dorsal mesentery. Each one you are seeing 4 numbers. And where they are also, I try to show in the pictures. So you can correlate that one and with this one. All these pictures are available in the books. Okay, so you try to make a table like this. So when an MCQ is asked, we can write. If it is, they give derivatives of dorsomesogastrium. What is the development of ligaments in relation with the stomach? If they ask from this, you can write easily which are coming from ventral, which are dorsal, like that. So this is also facilitate you. Then if you are seeing the bronchopulmonary segments, so when you are seeing in the dissection, okay, if they do a beautiful dissection, they can show the segments, and otherwise we will be giving you a bronchogram and how to identify the bronchopulmonary segments. This is one exercise you should practice, and this is the diagram you practice, all of you. Okay, how to draw that one. And then what is bronchovascular segment, and what is bronchopulmonary segment, and what about the position of vein, what position of artery, like that we will be asking. Then how to remember these things also is another question, and this is how you present it. I want to give you a mnemonic, okay? So try whether this mnemonic works you or not. Okay, I'll go back. Okay, so are you seeing it? So a palm, you write down vertically like this, and then give the gap and give the emalp as if there are 2 lobes, you write, but on the right side there are 5 segments are there, and the last 2 will go to the middle lobe, and in the lower lobe these are the ones in order. So this, and in the case of left side it's easy. The first 5 letters go to upper lobe and the last 5 to the lower lobe. Lower lobe is common for both. Hope this will help you, because most of the students and some of the faculty also, they said that this has helped them in remembering and reproducing. Okay. Then the vertebral levels and their importance also. C6 vertebra is very important. Okay. So what are all the events that are taking place in the C6 level? So you have to make a note of them, and then it will be available in somewhere, but the thing is you have to focus on that part. Okay. So if you have taken a snapshot, okay, otherwise they will give some other method to remember. And this is also transpyloric plane, they may ask it, L1. Along with that, what are all the things that are happening at the transpyloric plane? This you have to remember, and one of them may come as MCQs, not only here, through any of your exams you are going to face during your course. Okay, so this is something which you have to focus. And here, the another way of studying is discussion with your friends. See, we will make them groups, and you can also practice. Same thing in your hostel rooms also. Keep a whiteboard or white chart, draw the diagram and teach yourself, teach your colleagues and learn from them. Okay, so this is the way, and she is a good teacher. She is teaching effectively. That's what I feel from looking at it, and I have heard her talking also. So these are some of the things that should stimulate you, even in the short time also. You distribute the topics and make each one of you teach one topic. So like that, you can share 4 or 5 topics at a time, you can learn. And uterus supports also. I gave a picture. So this will give you about the functional components. So what is the upper part holding apparatus, you can see. And what is the middle part retentive apparatus? What is the lower part supportive apparatus? So ABC, if you go from below upwards, lower part, middle part and upper part. So you can correlate with the structures and supports for the uterus. At least the last one you should remember, and the other ones also, primary, secondary, you have to classify. And this I have already told you, and how to prepare a specific learning objectives and what content has to be studied and what is the method to read and how much time it takes. We used to give for 1 hour sessions like this, and students can practice after the theory class. They can categorize it into these reasons and learn from themselves, self-directed. And you can learn from the curvatures. So previously one has to draw diagrams, and then you can correlate the diagrams with the pictures, MRI pictures, and you yourself can start diagnosing also. Okay, so that's how you were made to be clinically oriented anatomy we have to learn. And similarly for the curvatures in the adult also. So take with the diagrams and see the pictures. Okay, so how you can correlate those things also from that picture, you can learn from it, and you can draw over that film also and take the lateral view of X-ray and the lateral view of the heart specimen, and this also. Okay. Then the same thing, coronary arteries also. This is a dissected specimen and this is the pictures, the CT angiogram, and that also you can correlate with your dissection. This is what I wanted to tell you the same thing. Don't think it will come somewhere else. It is, you should be able to practice on the cadaver, and the same thing you can practice on a living person, and when you are observing the X-rays also. See the intervertebral disc which you see in an MRI and in the dissection, which I have cut a section, and then we can show the students to correlate. Similarly, the femoral artery. Okay, so this is another one, and I think they have given enough examples. Okay, for the long thoracic nerve, and I need not draw a very great diagram, but I have drawn something remembering scapula and how the muscle is inserted into it. Okay, serratus anterior, and what is the nerve supply also I have shown it, and you can add some more. And this is I'm showing filum terminale, how briefly and crisply it was represented by a student in the examination. So that's what we expect you to do it, and take this as an example to start working on such things. And this mind mapping you are doing for most of the nerves, you are planning to do like that. And for a ulnar nerve, see that book, ulnar nerve is given in like this. So if you practice this diagram and the table, you will be able to write about it. And what about the effects of injury to various levels? This is the one that is required with a brief introduction of this one. And it will take hardly, once you are thorough with it, another 5-10 minutes you can do it. First read from this, and then you can go to the other book also. And this is another one. All of you start thinking about it. Maybe I will close with this one also if required. So your eyes are closed, blindfolded. An object was placed in your hand. Can you identify shape and texture and tell what it is? If yes, how is it possible? How was the integration between hand and mouth? Proprioception. Started thinking. Good. Describe the pathway concerned. Okay, stereognosis, very good. Okay, there's the one, good words. So how to link it? Okay, that is the one. And see this one and tell whether you will be able to understand the pathway. To simplify, you are using good words. Okay, yes, dorsal column pathway. And what is that pathway? Where is the first order neuron? Where is the second order neuron? Where is the third order neuron? This flowchart we should be able to give you a clue. Yes, you got the clue? You are getting the clue? Still not completed. Okay. Yes. Where it is crossing and what is its importance. Okay. And the same diagram. See how the somatotopic arrangement. For that, the larger one is useful. This is how I have drawn to understand for myself. Okay, so without understanding, how can I teach? First, I have to understand for myself. So this is the diagram drawn by me using the different types of color pencils. Okay, so now you also should do it and at least see that animation part, the simple animation that will help you. Okay, yes, first order, second order, good. You're writing, see? So you are able to do this one, okay? And yes, what areas it will go, because previously also I have shown one diagram. Okay, so you are equipped sufficiently with the required cells for identification of an object and naming it. Why not the same for responding to a question asked in the examination? And what should be your attitude? Think over. Okay, we are capable. Okay, yes. So that's what positive note is there. Something similar for the X-rays also, how to read for the sections also, how to correlate also. Okay, now this is my last slide. Okay, so teacher should be a torch bearer of change, reflection to revelation. The teacher should simply shine the torch. Okay, just throw the torch, guiding students to observe the full spectrum of light reflections So the student has to uncover minute details, probe into every corner that holds explanations, and it should lay foundation for understanding a topic and its application. Encourage, teacher encourage. Okay, teacher has to, role of teacher is to lay foundation, I agree. So encouraging the students to explore research potential, fostering innovations that benefit the society. So with this message, I will stop. Okay, thank you.
Thank you so much,
Deepa.
ma'am.
Okay,
Yeah,
yes.
thank you so much, ma'am. Please
Yes.
stay connected with us. In the meantime, students, ma'am won't be able to share the PPT. I'm really sorry for that. But we will be sharing the recording of this session on our YouTube channel. In the meantime, I have already shared many a times in between the feedback form. Please note the e-certificate will only be given to the students who will duly fill out their feedback forms. There are times when students report to us that they haven't received the certificate. The certificate will only be issued to the students who will fill up the feedback form properly. Also, in the meantime, I am sharing those who have filled the feedback form. I'm sharing the assignment shared by ma'am for this particular session.
It's a session that is a serious assignment is there for you. Let us see, because whatever doubts they have asked, I have put them there. Okay.
Yeah. So here is the link to third assignment, which is the final assignment for this series. May I request you not to use the chat room as of now, because I am sharing some links and in between your gestures, the link is gone again. So there's a question, ma'am. There's one doubt by a question. Ma'am, I have few doubts. Can I? So first one is I want to practice a lot of MCQs of anatomy for exam. Please 17 to 18 questions out of 20. Which book I covered my needs? So I would like to reply on to this question that there is a book authored by ma'am, which is Theme Test Prep series of anatomy, where all the MCQs are being covered in that particular book. Please avail a discount. We are running a discount of 40% on that particular book. You can avail the discount. I am leaving the link of the book as well as the discount coupon code for your reference in the chat room. The next question for this particular from this particular person is clinical question. I want to practice for exam reasoning questions too. PYQ models for new pattern paper, which and where I can practice. Any suggestion, ma'am? Subhadra Devi, ma'am.
Tell me. Yes, ma?
Yeah, there is a question for you, ma'am.
Yes.
They're asking for the MCQ. I have requested them to use your Theme Test Prep series, Anatomy. It has it's a wonderful book created by ma'am in the question answer format. So I believe your first 3 questions would be solved in that particular series. For PYQ models for new pattern paper, which and where I can practice, any suggestion?
What pattern?
PYQ.
Previous year questions, yes, you take. The best thing is take first last 5 years question papers. 5 into 2, you will get 10 question papers. If you could answer those 10 question papers, you are sure to get 60%. If you are perfect in that, okay. So at least
Also,
the
as
questions. Pardon?
so I'm saying also, ma'am, as you have authored one of your best series, it is
Yes.
one of the best series accepted
is
in the
best.
market by every student. Yeah. So I am extended an offer of 40% discount on the same series. You can purchase that from the link which I have shared in the chat room. And this is the coupon code to apply. This is only for this class. You can apply and avail 40% discount.
The book is written with question answer format covering all the NMC suggested components. Okay, that is one thing. Histology slides identification. You have to see the slide and identify. First is I have another component of it, mine, but it's not the platform to talk about it. What I would suggest you is think of it immediately after looking at a slide, see whether it is having a lumen. Okay, that is another thing. And whether there is the epithelium is there and what type of epithelium. So along with epithelium, is there any other component which you have studied in your basic histology? Any lymphoid component is there. Epithelium plus lymphoid component. So can it be any lymphoid organ? Lymphoid organ with epithelium component. What is it? So what are lymphoid tissues? General histology is the lymph node, tonsil, thymus and spleen. Of the 4 only, the palatine tonsil is having epithelium. If you think that it is palatine tonsil, is it having a crypt? Then it will be automatically the palatine tonsil. Otherwise, if you are seeing an epithelium and with lymphoid tissue, and see whether it can be any part of the small intestine. Think of it. So whatever the parts of small intestine with lymphoid aggregations, if it is, if you think it is the ileum, and whether is it just epithelium or villi, that is the characteristic feature. Like that, you have to differentiate it. These type of things you should start from now itself. Then there is appendix is there. It's not part of small intestine. So how to differentiate small intestine and large intestine? Absence of villi is one feature. Apart from that, lymphatic nodules. And in the case of appendix, you will see the entire lumen, but not in the case of small intestine. You have to move a lot to see the entire one, and usually it will not be seen. So like this, there are certain tips. So when you are observing, you have to focus on that. So I gave some example for that. Like that, for everyone, you can differentiate is one. And if you are seeing a lumen with elastic fibers and muscle, so what type of blood vessel? You have to think like that. Okay, that's how you have to go on demarcating. Okay. If we start now from the beginning, yes, definitely you will get it. You should start working on it, and you should get the smaller tips you should get from these lectures and from the books. You can get it and then do it. I think a paper pattern will be changed. They will send it if they have changed it, because they have to change it throughout. That's the thing. Somebody was asking yesterday also about Telangana, and ask your concerned teachers also. They will get the notification from the university. Histology slides and embryology. I have given some tips also, list of tools and all. And embryology, you should give one reading to understand the whole story. Okay, you should have it in one reading, and from that, make the short notes questions. The required ones are there. Only some few are there, and on that you prepare. Most of them I have shown in these 3 days. Most of the general embryology I have mentioned in some form or other. Histology, you have to go through with the tips. Okay. Which YouTube channel? I'm not getting.
So YouTube channel is on Theme India. You will find the series of this workshop. You can go through it, but it will take time. Once we upload these sessions, we will intimate you by sending an emailer on your registered email ID. Please note, ma'am has given a lot of time while developing the assignments for you. I have only got 50 response for today's assignment. Where was we have started the journey with around 300 plus participants. Right now also we have 263 participants in this session, but we only got 50 responses on the assignment. So instead of asking your queries assignment, maybe that assignment will arise some question in your mind. Ma'am is connected with us right now. We can take queries, but let's focus on the assignment as well to understand where what is the one topic which you have to really brush up.
So around July 15th,
So
afterwards, you can expect your examinations. And I'm not telling anything. First, go through the theme of book. Okay, you will have an idea. And
yeah, please
based on
please
your
go through the
capability,
book.
you can
Ma'am,
go to some other
I
book.
request you, instead of taking the queries right now, let's wait for 5 minutes. Ask them to complete the assignment, because you have taken out such a, you have designed it such as beautifully, taking out so many pictures. But I was seeing that this afternoon, and I can see that so much hard work has gone in there. So I request all of you to please attempt to that assignment. This is the last assignment. I'm sharing the link again in the chat room. For any kind of questions regarding the what are the questions, how the questions would be like, you can refer to the book authored by ma'am. Has written the content of this book. She has created the questions, and we are giving a 40% flat off on this series. I'm sharing that link as well as the coupon code. This coupon till 8 p.m. today. After that, it won't be available. It is for this class only. One more, I am leaving the feedback form in the chat room. Please note, certificate only be given as per the feedback form submitted by you. Later on, you reach out to our sales team or to me and asking that I haven't received the feedback form. I'm sorry, we would be only entertaining those people who would be filling out the feedback form correctly. It will not only help us to understand what is the correct name and email ID where we need to share. Other than that, we also get your feedback so that we can prepare these more series in future for other subjects too. So leave behind your feedback, do the assignment, as well as if you have any query regarding what kind of questions, please go through uh, the se- the test prep anatomy series set. It's a 3-volume set, authored by ma'am Dr. Subhadra Veli Chetty. She has put in so much hard work, and it's her vision of having a question answer format book, which is really useful for each and every student who wants to understand nearer to the date of examination. How can the question be arise? What form of question can be? So please utilize these things. There is no PPT to be shared. I'm sorry, ma'am is not going to share any
No.
PPT from any of the classes. These PPT are not meant to be shared. We have recorded the sessions. We will be putting up the sessions on our YouTube channel later on. We will be intimating all the students who have attended the class through an email as well as a WhatsApp message that the videos are now available online. But that would take a little bit time because we need to do the editing part on it. In the meantime, I can only provide you the link for the assignments which ma'am has shared with us, and we have provided in all the 3 sessions. I request you to please share the feedback form I'm really sorry. PPT cannot be provided again. I'm really sorry. Test prep series, it's a book in question answer format. It has both objective and subjective questions. It has digital resources to it. Once you purchase the printed book, you will get the resources to it. So avail the offer of 40% discount. I got 110 responses on the assignment. It's up to you students how to avail this opportunity. And I've got 298 feedback forms for the e-certificates. So it's a clear view that you don't want to do the assignments, which ma'am has put in a lot of effort to create it. I request you all to take out time. It's an objective type assignment. It hardly takes 5 minutes to finish it up. I will be sharing all the assignments where the responses to with ma'am, and maybe if in near future we would be having the second series of anatomy classes, ma'am would be referring to your assignments as well. So ma'am, I thank you once again for
Thank
taking
you.
out time. Give us these 3 dedicated classes, not only to the students, but taking out time for Theme to do these classes. Thank you so much from bottom of my heart, and we will stay connected. We will be getting in touch with you for a near future more classes as students are requesting for. I'm on behalf of Theme as well as from my behalf as well as students, they are sending out a big shout out to you. Thank you so much once
Thank you.
again.
Thank you for the opportunity.
Students, for
Nice meeting so many students here in this platform, and hope at least it will stimulate them, okay, to read at this point. What they require is
Yeah.
encouragement, and hope these lectures have encouraged them to focus on it and reading it logically and simplifying it, and not to expect something big ones which they cannot manage, because they have to read 3 subjects, and this is the vast
Yeah.
subject, and I tried to put a simplification part. To some extent I have succeeded in that part. That's why I encourage the students, especially those who are getting into stress, don't go into stress. Okay, so read, and take some rest also in between. Don't read continuously. Read for 15 minutes, take a break of 5 minutes to recollect what you have read. And then after 45 minutes, that is 3 such exercises, take a break of 15 minutes, take a lot of water, good food, fruit. Okay, all these things are also part of my teaching only. Okay, yes, which I advise.
Yeah.
Okay, thank you. God
Thank you,
bless you
ma'am.
all.
Thank you so much. I'm
God bless
stopping
you
the
all.
recording.